Palliative care is specialized medical care for people with serious illness, the goal of which is to improve the quality of life for patients and their families. I think patients often have concerns about palliative care. The first one is they think it means that they're at the end of their lives, and that is absolutely not true. Palliative care is for people at any age or any stage, and people who get palliative care will live years and years, and many people who get palliative care will actually be cured. So the goal of palliative care is to improve patients' symptoms so they can get the underlying treatment they need aimed at curing or prolonging their life. The criteria for getting palliative care is having a chronic illness for which you need a little more help. This includes patients with cancer, with heart disease, with liver disease, kidney disease, and a wide range of other illnesses. Palliative care probably isn't appropriate for patients with chronic but not serious illness. So, for example, patients with chronic back pain, while they're certainly suffering with pain, may not be appropriate for palliative care. Palliative care treats a wide range of symptoms. So the main thing that people think about palliative care for is physical symptoms, but we also treat a wide range of psychological symptoms. We work a lot with patients who have anxiety or depression or just general problems coping with their serious illness, which is pretty normal. So palliative care teams in general have 4 core individuals: a physician, a nurse practitioner or a nurse, a social worker, and a chaplain. In addition, palliative care teams can have a wide range of services that can include things like massage therapy, child life, music therapy, arts therapy, and a whole wide range of volunteers. Caregiving for someone with a serious illness can be quite difficult. One of the things that we do for caregivers is make sure they also understand what's happening with the patient's illness, make sure they understand the patient's medicines and how they should be given. So we work with caregivers to help relieve some of the caregiver burden and the problems associated with being a caregiver for someone with serious illness. We like to say that we do 3 things. We control pain and other symptoms. We make sure that patients understand what's going on with their medical illness and can make the best decisions. That is, translate medicalese back into English. And then we make sure that patients have the package of services that they need in the right setting. So whether that's in a hospital, or whether that's going home, or to a rehab facility, we make sure that patients have a package of services that they need to get them to their goals.